I can't write the unofficial book of all the stuff that has actually gone wrong in Hope Citadel, but a lot of it is HR, and Anna's had to walk us through it. So she's going to help us think today about how do we get the best out of people, how do we tackle situations, is that all right? And you can store up your questions either one-on-one later for all the staff conflicts you've got going on, or anything else. Thank you, Anna.
Thank you. I won't answer all the conflict questions today in front of everyone. So just a bit of an introduction on myself. So I've been working in primary care since I was 18. I started off as a receptionist, then I started looking after doctors' timetables, where I learned that the only time doctors cry is when their holidays get rejected. I learned that very, very early on. And then I moved up to Salford about 10 years ago, and I worked for Hope Citadel for 8 years. And in that time, we've grown from 50 people to 210. So we've grown quite a lot. And in that time, we've learned a huge amount about how to look after people. So from looking at Liz and Ian that have been with us almost all of that time, and looking at Kieran that's just joined us last year, we've learned a lot. Ian will definitely tell you what we've learned. So we're going to look today at recruitment, retention, a bit about quality, social mobility, and culture. And the reason we're talking about that today is because it's really hard in area deprivation to recruit and retain and keep quality and all these things that we're talking about here. So some of this is laced in what we've learned here in this context too. So the first thing I did, like anyone preparing a talk, is Google what does it look like to be happy in healthcare. If you look at the whole first page of Google, basically you have to be an actor to be happy in healthcare. But everyone seems very diverse, so that's nice, isn't it? Everyone's very clean and tidy, and everyone's wearing scrubs. So that's the answer. So first of all, looking at recruitment, I don't know how many people here are involved in recruitment, but we are all affected by the fact that recruitment is really hard in deprivation. There's less GPs, burnout rates are higher, sickness rates are higher, resources are lower. Does that feel like a story that people know? Yeah. The other side of that story, which I know well, and other people in this room know well, is that there's loads of people that love working in deprivation. So these are some of the stories of some of my colleagues, which you can read. But people love working here. People love working with people that are complex to just understand. People love the feeling of being able to do something proper. People actually love the opportunities that they're given. When they've lived here for a long time, they can give back. So there's lots of really positive stories as well. I didn't realise Ian was going to be here, so sorry Ian. The next video is a video that we did about 6 years ago. Do you remember it? To try and recruit some GPs into Hope Citadel.
I want to be really clever, like super amazing clever, so I can invent things and fix things and make things happen that no one else can.
I want to help people just like adults have helped me. When I grow up, I want to be just like them.
So when I'm older, I want to be able to invent things and make things happen that no one else can.
When I grow up, I would like to be a doctor because they make people better.
Now that I'm a grown-up, I get to be a doctor and have an input in lots of interesting people's lives. It's a privilege to get to know them and hear all their weird and wonderful stories.
So I came to Hope Citadel to play a part of an organisation that genuinely cares about patients and goes the extra mile to try and help work with people to make their lives better.
My reason for being a GP is because I love that interaction of two people as patient and doctor.
The most inspiring part of my job is being on that journey with people, starting it from the beginning, seeing how they progress, and giving the tools to that person just to help them be the person that they want to be.
When I joined here initially, I got a nice vibe from all the people working here who were really striving to to improve GP in a difficult area.
At Hope Citadel, we believe that the NHS should be best where it's needed most. We are really proud of the outstanding care that we've delivered in practices in Greater Manchester. We're looking for more GPs to join our teams working in areas of deprivation. So if you've been qualified for a couple of months or you've got a couple of years before you finally retire, why not give it a go and work somewhere that will make a real difference?
They actually both look about the same, I reckon. So we did that video 7 years ago. I just wanted to share it because I think recruitment is one of those things that is actually really hard to sell to people. Come and work with us. The days are going to be long. There's never enough appointments. The patients are the same everywhere. But actually there is something that makes us all work here, and we need to be able to sell it to people. And I would say that for all of our practices. I'm not just talking Hope Citadel. I really want us to recruit more people into deprivation medicine. So some of my top tips for doing that: we are a real living wage employer, and that's really important to us. That means that we pay the people in reception and admin at least £12 an hour, and that makes us feel like we are giving into our communities what we expect for our patients as well. And actually for our doctors, that is a really important thing too, because if you know that your receptionists, your administrators are being paid fairly, then that makes you feel like actually we're a team together. I can feel like I'm not the only one earning the money, everyone's doing this together. We also have really found that the more training opportunities you give people, the more they want to stay around. And that is for all jobs. So whether you're on reception or whether you're a doctor or a nurse, the more training opportunities we can give people, the more half-day closings which are actually thought through, the more kind of learning pathways you can get people on, the more they want to join in. We also have found over the years that adverts fall in different places differently, and it is a bit of a potluck game where an advert is going to land well. But over the years we've put adverts for receptionists in mosques or in community halls, and we put adverts for GPs on Facebook, and you get them in very different places. But what I would say is that your community and the people that you want to recruit, work out where they are and then put the advert there, and try and speak to those people, because there's no point putting a receptionist advert up on NHS jobs if you're actually looking for someone that would be really good in a pub environment to come into your reception team. You can go and put those adverts in different places. For recruitment as well, we focus a lot on culture and on how people integrate into teams, and we focus a lot on how they come across and how they would work in a team, a lot more than skill. Skill is also really important. We can't all just recruit naff nurses just because they're nice. But if someone is really, really good at their job but doesn't fit in with anyone at all, then that is not going to work for very long. So we look a lot about the culture, the values that people come with an interview. How are they talking about their previous job? How are they talking about the patients that they want to work with? And is that positive? Does that fit in with what the rest of the team want to do? We also had to walk this funny line between not sugarcoating the job and saying it's amazing, everyone's great, got so many resources, it's absolutely fine, and then also not just talking negatively about everything. So Laura and I met with a group of GPs that were trying to recruit to a coastal area, and the way they talked about their patients was that they were weirdos, that they didn't really know how to do anything with them, and we left thinking, well, we don't want to work there, ever. So we need to be able to talk about our patients and talk about the jobs in ways that actually invites people to come and work with us, while not sugarcoating it and saying it's all perfect. So next I want to talk about retention. In Hope Citadel, we're finally at the stage where we've actually got enough GPs for all of our practices. That has taken 9 years. Retention is tricky for all of us because all of us are thinking about what do we want to do, how do I want to do it, how many hours can I work, all those different things. But the most important thing to keep people working with you is to invest in the relationships. And I think that is the number one thing over anything else. So the time to sit down with someone, have a cup of tea, to remember when their birthday is, to remember what they like doing at the weekend and ask about it, all those different things make people want to stay with you. So whether you're someone that has authority within your setting to make recruitment decisions or not, you can be part of the retention of the rest of that team. We did a really interesting survey last year, year before, about seniority and what that meant to our GPs. And the main thing that came out of it was that what mattered to us was having people that were still going to be there in 3 years' time, 5 years' time. And actually that is hugely about relationship, not just about skill and about filling bums on the seats. I think that, especially in smaller practices, is about making sure people got time to build networks outside of their practice too. And one thing that we've learned a lot is that we need to have a culture that actually encourages and really puts at the centre rest and rhythm, and not expecting people to just work all the time. Because we all know that there's always enough work for us all to do it every day until at least midnight. But if we tell people it is your day off, why are you on emails? Or if we say to people, you said you're going to leave at 3 today, Claire, go and have a run around the park. Those things will make people feel like actually someone values something for more than just the doing the prescriptions and doing the med labs. So value that. Actually, I think there is a rhythm and a pattern of work that can include rest and include downtime that does actually make us more productive. And it's not because we become more productive that we want to do the rest, but it does mean that it's possible to be productive when you are meant to be working. Does that make sense? I also think that as a leadership team, we try to give people time to respond to need as well within our staff team. So actually, if someone's going through a really hard time, we need to be able to respond to that need and do that compassionately. So one of the things that we've done, I put it down the bottom, but it's part of that, is we realised during the cost of living crisis that not everyone was able to bring in lunch every time. So what we said to our managers at our practices was, please buy some cheese, buy some bread, and buy a toaster machine and make it a thing. Don't make it about cost of living. We don't care, we don't want to brand it. This is for the people that can't afford lunch. But what we want to do is respond to need and say, actually, every Tuesday we're going to all have toasties. There'll be cheese and bread left for the rest of the week, and that will help people have a meal. Fairness is massive on retention, and fairness does not always mean equality. We know that a lot from health inequality, don't we? I'm not saying do the same for every single person, but I am saying that people really recognise whether something's fair or not. And that's about pay, it's about family, and kind of in doctors' practices, we all know that there's people we drag in to do a summer job here and a this here, and this person gets work experience, that person gets work experience. We need to make it really fair for everyone. And we want to give people opportunities, whatever they've come with, to be able to go and do their career they want to do it. Retention doesn't actually mean everyone staying for 25 years. So I'm going off to be a foster carer, I'm actually still going to be around, but it's important that we all are allowed to do stuff that means that we say goodbyes well, as well as saying hellos well. And that, I think that shows to the team that are left, if you can do a goodbye really well and finish things with people in a happy place, it shows that it's somewhere that you actually want to stay. So this is the resilience framework, which is, here to look at it, lots of very small writing, you'll get the slides later. The resilience framework is actually mostly used for children, but as an adult, it's definitely something that I look at quite a lot. The resilience framework is looking at what do we need as humans to keep going and to feel resilient. And it's not just one thing, is it? So if I arrive into work and 5 people have resigned, someone else is off sick, the locum doesn't have a login, I can deal with that on a really good day. On a day where I've forgotten to eat breakfast, I've already slept for 2 hours, and I'm just feeling really stressed because I actually don't know what I'm doing next month. That will make me feel less resilient, less able to cope with it. The resilience framework is a really good way of being able to talk to people about why things are feeling hard at work. So I talked to people a bit about a Jenga block and how actually if you pull out too many pieces, it's going to fall over. So what pieces can we put back in? Because we can't always put in, okay, we'll just reduce the workload completely. And we can't always put back in, yep, it's great, we're going to have a new team from next week and it's going to be fine. But we can sometimes say, have you actually eaten well this week? And is there anything we can do to make sure you're not eating pizza tonight as well? And lots of other little things in there will make someone feel more resilient and be able to cope with stress in a different way. Does that make sense? So the next thing I'm going to talk about is quality. So I'm going to show you a 1-minute video about people in a very different context.
You got a moment?
Yeah.
What do you think of Abby?
The one who never writes anything down. I don't know, what do you think of her?
Well, she's certainly, it's good to have additional support.
Yeah, well, taking a bit of a load off you, which is good.
And I guess it takes time to learn.
Of course it does, yeah. We can talk openly.
I think she's terrible.
Oh, she's clearly not up for it.
Thank God, I thought I was going mad.
No. I'm surprised she can find her own desk.
That's not her desk. I think we need to get rid of her.
After 3 months, how are you going to do that?
I was hoping you'd know.
I don't think anyone knows anymore.
She's got a performance review coming up.
Well, that gives you a chance. But in the meantime, maybe have a chat to her, like drop a hint.
Such as?
Oh, how do you think you're going? Have you thought about things that you might do better? Or have you thought about if you were to rank yourself out of 10, what would you give yourself?
Have you thought about resigning?
Yeah, that's not a hint, though.
Have you thought about changing careers?
I wouldn't be starting there.
Anyone thinking of anyone specific in that video? So quality and performance, both really complicated things to think about in healthcare. And partly because we work in teams a lot. And so the outcomes are not the same. So if you look at HR stuff online, which I would recommend no one does, but if you do, performance, quality, really easy. You work out how good someone is, and then you fire them if they're not doing anything well. And that's just it. But in healthcare, that's really tricky, isn't it? Because you might have 2 doctors, one of them might overrun by 3 hours, the other one might be finished always on time. Who can tell me who the better doctor is? Actually, we won't have that answer straight away. And there's a lot of different things that we talk about in primary care that does matter. It does matter that we have a team that is good. It does matter actually that we reach our targets because we need that money. It does matter that our team get on with each other and with the patients and that we don't have complaints, going through the floor. But how do we actually do that, and then what do we actually do about it? So one of the things is that what you measure is the stuff that you will notice. So what are you measuring? Are you just measuring QOF, or are you also measuring how many people you're exceptioning? Are you just measuring whether someone does all the docman, or are you actually measuring how well they engage with that docman and what they see from it? Are you looking at how many complaints a practice gets, or are you looking at how they engage with people? All those different things are important. And actually, it might be that we need to measure more things than we're being asked to measure by the powers that be in order to really know whether we're doing work in a quality way or not. Quality and performance in healthcare are really, really linked to motivation. So if we have, what we normally have in healthcare are teams that are very highly trained and very highly qualified to do what they're doing. So at the kind of base point where you've only got their CV, they're probably going to be good at what they do. Whether someone is motivated to do well and whether someone's motivated to do the best they can do is all down to the team around them and how they're engaging with that team, and particularly people's managers or people that they see as someone in authority, so a doctor. So what does motivation look like for each of those people? Normally not a poster on the wall saying keep going. Also not a poster on the wall that says we can do better next time, this is our cross score this year, please let's do better next time. There's a lot about small conversations with people. There's a lot about understanding what gets someone going. So some people love targets. I know that some of our managers, if you give them a target, they will get there and they'll be so proud of themselves, they want to make sure that everyone knows they got there. other managers, actually, that's so demotivating because all you're doing is tracking me and you don't know what I'm doing in my day and you don't realise how much work I've done today, that giving them a target really pisses them off. So it's understanding people, isn't it? And understanding people that you're working with and what does that look like. Praise and encouragement, not in a very blanket way that says, oh, I think you're all brilliant, but really kind of recognising how to motivate and encourage specific people in specific ways. And a massive thing in that is that appraisals are the sort of thing that sometimes, or internal appraisals, are sometimes the things that managers do because they have to, because CQC will tell them off if they don't. But actually that one-to-one time is really important for building that relationship. And clinicians really value another clinician's time, especially in that very face-to-face way. So what we've learned is that our nurses, what they would value the most is 20 minutes with a GP to go through some case studies and make them feel like they know what they're doing and get that encouragement from them. And so we've tried to build an appraisal process for our nurses that actually isn't about have you done your mandatory training, although that is important too. But it's more about sitting down with the GP and going, right, really enjoyed, like that's such a good record, well done for doing this. And I really saw the difference that's made to the patient. And that comes hand in hand with mentoring and supervision. We all know that we're being asked to mentor, supervise far more people than we have time to do. But it does make a difference. So if you can grab 5 minutes with someone, if you can grab 10 minutes with someone, if you can link up with some of the mentoring schemes that are going on across the country, it does improve quality and improve motivation. Saying all of that, sometimes HR gets called the fluffy stuff, doesn't it? Because it's the people that are saying, oh no, we can't sack them yet because they're just too nice and we need to be nicer to them and then they'll be nice and it'll be fine. But I actually think it's really important in healthcare to really notice when something is dangerous and notice when something is actually dragging the whole of the rest of the team down and then to act very quickly in that. And different people around the room will have different access to HR support, I understand that. But if you know that something's not right and you know that person's not right for that team, there are things you can do about that. And we should move to protect the team and the patients when we can. So, I just want to talk a bit about social mobility, which I actually don't like as a phrase. I grew up in a very working class area. I don't want everyone there to become middle class, that would be really boring. But there's something about enabling our communities to do the most that they can do and to experience life in its fullness, really, of being able to do stuff not limited by experience and money and family and all those different bits. So it's just worth us knowing that if we're working in dairy deprivation, this is also our recruitment ground for most of our jobs. Half of our staff are reception admin, and most of those people live within a mile or two of their practice. So let's be proud of that. Let's be proud of that culture. Just because clinicians might at the moment be coming from different areas doesn't mean that that is not our culture of our practice. We're really proud to offer work experience placements a lot in our practices, and we love it. And I think it's really important to do both. So I really want middle class kids to get a chance to know what it's really like in an area of deprivation, because that will mean that when they end up in a position of authority or privilege in another sector, they will be able to see that and say, actually, I want to do this really well because I know what people live, I know how people live, I know what it looks like. But also, I do not want the only work experience placements in Hope Citadel to be people that we all know or are related to, because I want kids on the local estate to get a chance to see that too. So we're really proud to be able to offer work experience to both, and we think both are really important. And I would really encourage you, if you've got any capacity, to try and do that too. Schools will absolutely bite your hand off if you say, I've got a work experience placement for a week, any time in the year. So just offer it. I think it's also worth understanding that all the stuff we talk about in terms of trauma, ACEs, backgrounds of poverty, might be just as relevant for our staff as it is for our patients. And if you were making a decision for your staff as if they were a patient, would you do anything differently? Sometimes conflict, especially if you're on reception desk, can be really triggering for a receptionist because of what they've been through and because of how they react to conflict. So conflict training in a way that actually understands their experiences and tries to walk them through that can be really important in terms of social mobility. And just acknowledging that life is really tough, and if someone comes in, you might react in a way that is from what you've experienced, where you've come from. Working with local schools, being good employers, all the sort of stuff that reminds us that our doctors' practices are in the community and they are people that are making a difference to the community around them. Staff as well to get on apprenticeships that are not just based on their qualifications. So a lot of our staff actually might not have got the right GCSEs to get on an apprenticeship course and might need to do a night course to get some extra A-levels or GCSEs, and actually kind of supporting people, encouraging people, talking to them about what their options are. Once they're out of that school system and they're working for you, that's your chance to kind of show them what's possible and talk them through pathways they might never have thought of. So I grew up with a lot of different medics in my family, which means that I actually knew from a very early age I didn't want to be a doctor, for one. But I also knew how to be a doctor if I wanted to be one. If you don't have any doctors in your family, you don't know that. And you don't necessarily know how to become a nurse, or that being a nurse is different from a doctor and what that looks like. So just taking the time to explain to people, do you want to be more clinical? This is how you can get there. Let's do this together. Has made a big difference to some of our staff. And the other thing is actually encouraging access to the right to benefits. So I don't know if anyone knows this, but there's you can claim back tax for uniforms that you had to clean yourself. And there's lots of other bits of tax stuff that you can claim for. And there's benefits that people can access, like PIP and things like that we might think about for patients, but it's worth thinking about it for staff as well, to help them access what they need. So this is my last little slide, culture. This is a sign that I saw in an office a few weeks ago. Be brilliant to work with, and I really liked it actually. That's what I want our culture to be like. I don't think my microphone's gone a bit so. I want us to have a culture where we're not thinking about all the processes and protocols all the time, but I'm thinking about how can I be brilliant to work with, and how can we be brilliant to work with. So for the last few minutes, I just want you to look around this room. Why do you want to work with these people? If you do. Also, in your mind's eye, look around your practice team. Why do you want to work with them? What makes it a practice you want to work at? And then, as a kind of reflection as we go on to the rest of the day, how can you encourage that culture in your team, even when the days are really hard? Okay.